Well, I'm super excited about the Education Center opening up soon. You know, when you have kids who have complex medical situations and you're trying to keep them current and up to date in school, it's almost impossible to accomplish that without additional resources. So I'm just very, very excited and proud, really, that we get to offer these additional services to our families. Managing childhood cancer or other, catastrophic conditions that these kids have is a real challenge. They need very, very specialized education services, even if it's just re-entry into the school system. How do we go about doing that? These kids fall through the cracks all the time. And so our education center is really geared towards helping them through their journey so that they can be intact when their cancer is cured or their chronic disease is under control so that they can go on and live a normal life. I think that kids who are sick, they shouldn't be allowed to fall so far behind in the education center. I've always wanted an education center as a component to Cure for the Kids Foundation, and that's based on my own experience with my son when he had his medical situation. From 14 to 18, we were addressing his medical needs, and his freshman year in high school, I think he only attended like 29 days, and so keeping him on track, the homebound system was complicated and didn't really meet our needs. My son was attending a private school at the time, so we didn't have access to some of the Clark County homebound systems, although in retrospect I understand now that they probably would not have met our needs. In my experience, the education component of a teenage life is complicated enough. And then when you layer in frequent hospitalizations, frequent need for medications, and they don't feel well, or they're having some difficulty in focusing, or whatever the case might be, education and keeping them on track becomes as much of a burden as the actual medical care itself. And oftentimes with my son, keeping him focused on his education was more challenging than navigating the healthcare system.